So I will provide an overview of digital technology for healthcare to support SDG3, good health and well-being. As we know, the United Nations outlined 17 life change goals in 2015, as shown in this picture. Nearly all countries in the world have promised to improve our planet and the lives of citizens on the Earth by 2030. As an academic in science and engineer, we can use our research and education to make contribution. I'm particularly interested in 4 goals, such as SDG3, to enable all people to obtain a quality education, thus improve people's lives and sustainable development, and enable people to, to ensure a healthy life and promote the well-being for all ages. And SDG4 is to enable all people to obtain a quality education, thus improve people's life and sustainable development. And SDG7 to ensure access to affordable, reliable, sustainable, and modern energy. And SDG9 to build a resilient infrastructure to promote inclusive and sustainable industrialization and foster innovation. Today, I will focus on how digital healthcare technology to support the SDG3. So this diagram shows the global burden of disease in 2009. Obviously, Africa has a larger disease burden than other countries or regions. The disease burden is measured with disability adjusted life years per 100,000 individuals. The life expectancy of different regions in 2021 also shows that Africa is the lowest, only 61.7 years lower, almost 10 years lower than the world average, 71 years. The health and well-being is one of the most important factors for life expectancy. This indicates the health and healthcare levels of different regions in the world are unbalanced. According to the World Economic Forum, 5 aspects of health and healthcare should be concerned, such as sustainable healthcare system, preserving healthcare technology, preparing for and responding to the epidemics and the health access. So according to this all of this need support from the whole society, such as investment, science and technology resources, government policy and regulation, healthcare providers, and etc. According to WHO, 90% of countries have reported disruption to healthcare service during the pandemic. COVID-19 revealed fundamental problems with our capital-intensive and hospital-centric model of healthcare. In order to achieve SDG3, good health and well-being by 2030, health system will have to change the delivery model to allow efficient connection with the patient and the communities. To ensure every person on Earth has equal access to the highest standards of preventive health and clinical care. A new collaboration model enabled by digital technology, AI, and data science is necessary for health delivery. Advanced digital technology can be used to create a new collaboration model for health delivery by making service more accessible, breaking down the geographical barriers, facilitate communication between patients and healthcare providers. Enabling the remote monitoring of patients with chronic conditions, streamline the administrative process, allowing efficient electronic data management, reduce costs, and promoting data-driven innovation, empowering individuals to take control of their health and make informed decisions about their well-being, also promoting personalized medicine. So digital technology changed the way of deliver healthcare to patients, as shown in this diagram. Health and innovation consortiums such as researchers, health professionals, and other stakeholders work together, provide various healthcare platforms being integrated into the clinical workflow. For example, prescriptive medicine can be ordered online and automatically delivered to the patient's home. Online consultation from a doctor, electronic medical record allow efficient management and data sharing, and wearable devices enabled by IoT technology can continuously monitor a patient's status and help predictive medicine. Especially genomic sequence technology development plays a crucial role in advanced personalized medicine and treatment, such as genetic risk assessment, precision diagnosis, and target therapies. Aging population is a critical issue in current society, and it greatly increases the burden of care. It is imperative that robots enter homes to reduce the burden of caregivers and relatives. So this picture demonstrated some state of arts in home care robots, but not limit. Both medical care and caretaker robots are in various stages of use and development. This is particularly good for those who experience age-related cognitive problem. Japan has taken the lead in the area of robotics as service workers. Robots can help people keep track of medications. The wearable robots for the paper have been successfully trialed in the UK, like this picture, and Japan. As shown in this picture, the robots are used in the care of home to help reduce loneliness of elderly. Cleaning robots have worked at home in different ways, especially in the UK. Chinese research already developed multifunctional bath robots. Japan have developed early time developed a meal assistant robots and the recent famous Japan robots, Robia robots, can move people from bed to the wheelchair. So AI technology are driving the development of care robots, include machine learning, deep learning with computer vision to improve the cognitive capacity of robots, natural language processing, social and emotion intelligence, gesture behavior recognition to improve the human-robots interaction. Autonomous navigation allows the robots to work in various environments. Personalization and adaptation, and robots health monitor assistant for individuals to improve the performance of robots service. So AI and data science have a great potential to revolutionize medicine and healthcare by driving innovation, improve patients' outcomes, enhancing efficiency, and transforming the delivery of healthcare services. So here are some important areas where AI and data science plays important roles. For example, AI-driven genomic data analysis to promote personalized medicine and reduce side effects. AI-driven medical imaging on X-ray, MRI, and CT scans can improve abnormality detection and diagnosis. AI and data science can accelerate the drug discovery process to identify potential drug candidates, predict their efficacy and safety profiles, and optimize drug formulations. AI-powered clinical decision support system can assist healthcare providers to make evidence-based decisions to improve patient improve patients' care and safety. AI-driven continuous monitoring of patients' health data remotely using wearable devices, sensors, and mobile apps to allow early intervention and predictive management of chronic condition. So, and predictive analysis will also allow preventive measures and personalized interventions and healthcare cost reduction. Natural language processing enable the automatic generation of summary, coding, diagnosis, and procedures. AI algorithm can optimize healthcare operations to improve efficiency, reduce cost, and enhance patient satisfaction. Data science can support public health surveillance and outbreak prediction. Also, AI is a key technology for improved cognitive capability of care robots. So remote surgery is a new surgical model in which doctors operate on patients with the help of surgical robots involve many technologies such as robotics, dynamics, communication technology, for example, 5G, 6G down, AI and VR technology, sensor technology, remote control technology, computer vision, and space mapping algorithm, and fault tolerance analysis, etc. Thus, realize the fundamental function of the system, such as the motion of surgical robots and vision of the main knife with a stable signal transmission and a safe remote operation. The development of application of remote surgery robots has become a new trend, which can help break the barriers of unbalanced regional medical resource allocation, promote the rational allocation of high-quality medical resources, and solve the telemedicine problem in special area and special circumstance. So safety and security is the most important in surgical robots. Here is a very simple framework of a digital twin of surgical robots with blockchain technology to ensure the safety and the security of a surgical robot system. The system consists of 6 blocks: physical surgical robots, the digital twin of the surgical robots, VR, AR system, the surgical console, information exchange with AI assistant, the twin synchronization, and the blockchain network. So the sensor status on the surgical robots instantly transfer to the digital twin, which will provide commands in return to control the surgical robots. Human operators can observe the status of the surgical robots on the patient through the VR or AR technology, and the feedback will send to the surgical console. So where the command is sent to the control the surgical robots. It is here I need to mention that it is very important that the synchronization between surgical robots and the digital twin. Cybersecurity is critically important, and the cyber attack could severely affect the safety of the surgical robot system and the patient. So a blockchain technology can be used to secure the system, providing immutable record keeping for security forensics, secure data sharing among multiple parties, as blockchain provides decentralized and tamper-proof where transparent transactions or events related to the robotics system operations maintained and the interaction can be recorded. So although the digital technology offer numerous advantages for healthcare sector, they also bring some critical challenges. The first is privacy and data security. Protecting patient data from unauthorized access, data breaching, and cyber attacks is a major challenge in healthcare. The second is the quality of information. Issues such as incomplete, inconsistent, and wrong data can affect the reliability and usefulness of digital health data for clinical decision making. accuracy and bias and fairness of diagnosis, ensure the fairness of a high-performing algorithm, mitigate bias are critical to prevent discriminatory outcomes and ensure equitable access to healthcare service and resources. Transparency and interpretability are particularly important for AI-driven healthcare to maintain trust and ensure patient safety and enable effective decision-making. Achieve the interoperability between different IT systems in healthcare sector to enable seamless data exchange and integration is a complex challenge that requires standardized data formats, protocol, and interface. Implement trusted human-machine interaction is a challenge. Leads to design intuitive and user-friendly interface to enable clear communication and interaction between human and machines with a strong cognitive capability to deal with various human conditions and emergencies. Integration new technology into the clinical workflow and practice can be challenging. Resistance to change, lack of training, and concern about the disruption to establish the process can hinder the adoption of digital solutions by healthcare providers and organizations. Safety and fault tolerance is a key challenge for digital health system, especially for home care robots and surgical robots. Compliance with ethical and legal regulation addresses this issue, required clear policy guidelines and regulation that balance the benefits of digital innovation with ethical principle and patient right. Training and adoption. Both healthcare professionals and patients need training and support to effectively utilize digital technology in their practice, thus promoting the adoption and public acceptance of digital health technology. So address all this challenges to create a trustworthy digital health system requiring the collaboration between healthcare stakeholders, including policymakers, regulators, healthcare providers, researchers, technology providers, and patients. By working together, it is possible to realize that the full potential of digital technology to improve healthcare outcomes, enhance patient experience, and reduce healthcare costs to contribute to SDG3. Thank you very much.